And it's my pleasure to introduce to you Elizabeth Lawlor, who serves as our Director of Epidemiology with the Department of Health and Environment. Elizabeth and I go way back, worked with her for many, many years, and I feel very fortunate to have her as a partner and colleague. Uh, Elizabeth joined the Department of Health and Environment in 2015 after working for several years up at Kansas Department of Health and Environment, which is where we actually got to know each other. But in her current role as Director of Epidemiology, excuse me, Elizabeth works and leads a team of epidemiologists who collect and analyze data from the community to inform policies, strategies, and interventions to improve the community's health. So it's my pleasure to introduce Elizabeth Lawlor.
Thank you, Charlie. Oh, last one before lunch, y'all. All right, we got good lunch coming. First, let me take a moment to say that the data I'm going to present to you, as you heard from Valerie this morning, already, huh? I'm going to try not to have that happen. So again, I'm Elizabeth Lawlor. I'm the Director of Epidemiology. And I wanted to pause and say that I'm going to present a bunch of data to you, hopefully not, just overwhelm you, but none of this work that I'm going to present truthfully was done by me. I have a phenomenal team of staff, several of who are in the room this morning, who were really the ones behind this, who are doing the hard work of getting the data and working through it. So today, what we're going to talk about is some of that deeper dive into the community health assessment that Valerie alluded to this morning. And then I'm going to talk about some of the data. Some of it's similar to what's in your workbook. Some of it's a little new, but really trying to give you sort of a story and help you understand what Johnson County looks like. So just as a refresher, we look at data in a couple of different ways. And the first was our local primary data. And so these were really our community health assessment survey and our focus groups. Okay, I'm just gonna stand all the way over here and see if that works. And now on this survey, we had these two questions. The agreement component, so how much do you agree that this condition, this issue exists in Johnson County? And then how important is this to your health and well-being, or to Johnson County residents' health and well-being? So as you heard from Valerie this morning, these were our top 10 issues based on that importance. So how important is health insurance within someone's budget to their health? How important is affordable housing to people's health and well-being? But again, this is only simply a small part of the story and of our data, because we have these two different questions. So the next thing we wanted to look at, because it's great if it's important, we want to know what people believe in our community matters to their health, to their community's health and well-being, but that doesn't tell us the whole story, because it could be important, but we could be doing great at it. What we wanted to sort of elicit from this analysis and from our community health assessment is, where do we as a community focus our efforts? Where do our community members say, we're not doing such a great job? This is where you need to prioritize your work for the next 5 years in your CHIP. So again, an agreement, when somebody has a low score, when there's a low agreement score, what that means is that they don't think, the individual who responded this way does not think that this condition exists in Johnson County. And for the importance, if it's a high score, that means that it's very important to people's health and well-being. And what we can do here is we can actually look at the gap, the distance between these two scores, and essentially that line, that gap between those two pieces is the amount of work that we need to do as a community. So when we have a much larger gap between these two scores, it means we have a lot to do. And a smaller gap means we're doing pretty good as a community. It's kind of complicated. So let's look at an example. So our question of community members of all ages can access recreational activities. So this had a high importance score. So it's very important that our community have access to recreational facilities. And it had a high agreement score. So this means that Johnson County has conditions in which community members can in fact access those recreational facilities and activities. So this means it's a small gap. We don't have a whole lot of room or work to do on this. Let's go back to affordable housing. Affordable housing has that high importance score. We all know that safe, stable, affordable housing is critical to our health. When we think about Maslow's hierarchy of needs, that is one of those pieces. But Johnson County respondents to our survey said, we're still not doing so great. There's a lower agreement score. And so this means the gap is larger. So what we wanted to do is we wanted to look at all of those 23 topics and say, what has that highest gap? Which of these gaps rises to the top where it's something that's important for health, but maybe we as a community are not doing so well with it? So when we look at these 10, which are the ones with the highest importance, we find that 3 of them drop out of those top 10s when we start looking at what has the biggest gap. And instead we add these 3. People are mostly free from constant stress or worry. This was 14th for importance. Prescription misuse and illegal drug use is not a problem in Johnson County. This was 18th in terms of importance. And transportation is available to people of all ages and abilities. And that was 19th in terms of importance. So you can see that this is, when we start looking at these gaps, it starts shaping the story just a little differently. So much like Valerie described, we wanted to ensure that our populations who have a history of adverse outcomes, inequalities, inequities in health outcomes because of historical pieces around racism, disinvestment, as well as our other populations that we know can struggle to find different resources, such as our 65 plus population. We wanted to take these populations that we had enough responses to on our survey and really try and flesh out what's important and what are we missing and where are those gaps for each of our priority populations. So what we want to look at are the ones that were consistent. So this is where we'll start. Affordable housing is available for all. Healthy foods are affordable. People have access to health insurance within their budget. People are mostly free from constant stress or worry. The criminal justice system is fair for all. And prescription misuse and illegal drug use is not a problem in Johnson County. So these 6 statements or topics from our survey rose to the top. They were in the top 10 of those gaps. So the biggest room for improvement in our community, the place where we have the most work to do, these 6 were consistent among each of our priority populations. I got some cameras going. I'm going to give it a second. All right. Now, what was close to being consistent across the board, but maybe didn't get all 4 of those groups? So the ones I'm going to list here had 3 of our 4 priority groups that had those bubble to the top in their top 10. The first is that people find and keep jobs that can that pay well enough for them and their family. Now, underneath you can see who had that in their top 10. Our 65 plus population did not feel like this was a thing for them. I get it. They're not quite as worried about those jobs. Understandable. The next is treatment for mental health is affordable. What we saw here is our Black and African American respondents to our survey did not have that bubble up to their top 10. This was actually 12th for our Black and African American respondents, with 11 being alcohol misuse. Laws and policies are applied fairly to all people, and transportation is available to all. We're the top 10 for all groups except for our Hispanic and Latino respondents. These were number 11th and 13th for them. And number 12 for our Hispanic and Latino respondents was childcare options are affordable. So these are ones that still have a fairly high level of agreement amongst those. And much like Valerie took a look at, I also think it's important that we see what was singular for our different priority populations. So what we see is that excessive alcohol use is not common in this community. Our Hispanic and Latino populations respondents had this actually as 3rd for their gap. So really high up there for the respondents who identify as Hispanic and Latino. They think that this is a problem. It's important in our community. It's important for well-being and health, but we as a community are not doing as well on it as we should. Medical care and preventative screenings are available for all. So for Hispanic and Latino respondents, this was 9th. And for our 65 and up population, this was 8th in terms of their largest gap. And then neighborhoods are racially diverse. This was one of the top 10 for our Black and African American respondents, and they ranked it 8th as well. So where do we go next? I'm gonna try and walk this way, y'all. Okay. Water and time check. So we really get two key pieces of information from the survey, right? We have that importance and we have that agreement and we have our gaps. And so when we looked, what we did next, because right, there's a lot of data, y'all, that exists in the world, a lot of it. And we can't just throw all the data at you. It's not fair for you all to try and figure out how to make sense of it. That's really our job. So we wanted to see which of these topic areas from our CHA survey did we really want to focus some of that additional data research on, additional data polls. So what we did is we looked across the priority groups, those 4 groups, our respondents who identified as Hispanic Latino, those who identified as Black or African American, those who were low income, and those who were 65 and plus and up. And we looked at both importance scores and we looked at gap scores, and we tried to see which of these questions or topic areas came up to the top across the board. And we identified 9 topics. So here are the 9. People have access to health insurance within their budget. Affordable housing is available for all stages of life. Laws and policies are fairly applied to all people. People are mostly free from constant stress or worry. Prescription misuse and illegal drug use is not a problem. People find and keep jobs that pay well enough to support themselves and their family. Treatment for mental health issues is affordable. The criminal justice system is fair for all, and healthy foods are affordable. Now, one of the pieces I haven't touched on that you heard from Valerie this morning is our focus groups. So the focus groups are really a part of that very initial phase where we went into our community, had these really focused community conversations about what issues were what issues individuals who are at our focus groups were facing. And we had 79 individuals who participated in these over 8 different focus groups. So we wanted to look at where did these fall in the focus groups. So we had 8 focus groups, and these are how many focus groups each of the topics were mentioned in. So for 5, that treatment for mental health, or sorry, the bottom left-hand corner, with the asterisk, treatment for mental health is affordable. That wasn't explicitly mentioned, but it was talked about as medical bills. So we sort of thought within that space, right? The one that was not explicitly mentioned was prescription misuse and illegal drug use. Now, this did bubble to the top. This was put on our CHA survey because it was one of our priority areas from our last round of our community health improvement plan. So we want to make sure that we're tracking that. We also know from the data, from our secondary data and from local data, that prescription misuse is a problem. And so because of this, prescription and illegal drug use, sorry. Because of this, we are also going to continue to look at this, even though this is one of those spaces that was not identified in our focus group, but it did come to the top among our community health assessment survey respondents. And I will just say too that the focus groups are a set period of time and conversation, and there are other issues that took more time or came to the top for them in those conversations. So we've talked about our primary data. We've talked about how we've looked at our community health assessment survey, primary data being the one that we collect. Now let's talk about some of our secondary data or some of those state and national data sets that we go to. I do want to take just a minute because I'm an epidemiologist, so I have to talk about data limitations here. We have some. One is that, to be really honest, with our census data, with our demographic data, we are very much limited to how we can talk about the data based on how it's collected at the national level and how it's described to us from the national government, right? From our Census Bureau. So there are times where we're not able to look at a certain data point by all the populations that we want. So I want to acknowledge that we don't always have the data to tell the complete story. Secondly, we like to, when we present data to you, we like to have enough people who responded that we feel pretty confident in that number, right? Like if we only have 2 people who responded this year and we had 4 people who responded next year and I said, y'all, we had double the number of responses, you're like, okay, it's 2. Like, is it really? So one of the things that we think about is how many people exist within these data points that we're talking about. And so sometimes we have really small numbers. Our population, while it is diverse and increasing in diversity, we still have some small numbers of certain racial, ethnic, sociodemographic groups in our community. So we can't always have the data to talk about everyone all together. And now finally, Our epidemiology division is fantastic, and we have a ton of capacity to actually analyze data in-house for ourselves that can get at some of these questions. However, much like everything else, policy and staffing changes from our partner organizations have slowed our ability to get this out. But you've already heard once about Health Happens Here, our dashboard. I'm going to plug it again at the end. And so stay tuned, and we're going to have some really great data and additional data than what you're going to see here to talk about our community's health. Okay. Now, the other thing I want to talk about with data is sort of this idea of a square peg in a round hole. So the fact that we don't always have the data to talk about certain populations. We don't always have the data to talk about actual certain issues. Or sometimes we have a data point that kind of points to it. That's sort of like that. Or we have a couple of data points that sort of get at it. So I just want to acknowledge at this point that some of those priority areas, that I spoke of, you're not going to find in your workbook. Some of them we have data for, it's kind of close to getting at it, but it's not really there. So very briefly, data that loosely point to the issue at hand. People are mostly free from chronic stress or worry. We can talk about some data that we collected through our community health assessment, which is really critical. We can talk about, people who have maybe some poor mental health days, but like getting at that idea of chronic stress and constant worry is a really difficult thing that, quite frankly, none of the other data sources have gotten at, any of the different surveys that our group tends to look at. Additionally, people have access to health insurance within their budget. You'll see data in your workbook and today about uninsured individuals and how that is disproportionate in our community, but that doesn't get at that affordability. We can talk about Medicaid, and we will briefly, but it doesn't talk about how much are people actually paying for their health insurance. Are they going to the marketplace and having to spend a lot of money? What about employer insurance? What about copay? Just because you have health insurance, are you able to afford your actual health care? So these are data points that we kind of can get at, but really we're still missing a large piece of the story. I'm trying to get this, y'all. Now, there's also limited to no data publicly for for several of these as well. One, the criminal justice is fair for all. We heard Angela, thank you. And we work actually really closely with Angela and some of their team on criminal justice data, but it's not available publicly. So we can't share any of that. But I do know that at least within certain components, CJAC, the Criminal Justice Advisory Committee, our disproportionate minority contact group, they are working on data and how it pertains to disproportionality within the criminal justice system. Treatment for mental health issues is affordable. Y'all, I got one point on this, and it literally came from psychologytoday.com. So that's where we're at. So again, I can point to it. We know it's a thing, but it's really sometimes hard to quantify what the depth of the issue is. And very similarly, laws and policies are fairly applied to all people. We know historically, we can talk about historically, but in this moment, that data point that says this is why and this is what comes to, we don't have. So these are opportunities for us to continue to work with partners, to continue to find better data, more data, to encourage data to be collected in various spaces so that we can continue to tell the story of Johnson County fully to meet the needs and wants of our community members. Now, no more limitations, no more ranting. So what do the data tell us? So I'm just going to run through a couple of very quick data points here. This is not exhaustive. Come see our website when we're done. But I want to take a minute, right? Johnson County is very much perceived, we're very wealthy, we're very white, we're very all these things, educated, and we are. Do not get me wrong, overwhelmingly. But when we look at our low income population, so those are going to be individuals who are earning less than 200% of the federal poverty level, which I believe is about $46,000 for a family of three, somewhere in there for low income. Do you know that there are 84,000 individuals in Johnson County who fall into this category? That is more people than will fit in Arrowhead Stadium. That's why I got the Chiefs there, y'all. Chiefs Stadium holds about 76,000. If we had all of our low-income residents go to Arrowhead, they'd be out in the parking lot. We'd have too many people. And when we look at those who are living below the poverty level, what we actually see is that 1 in 4 are under the age of 18. These are kids. Now, in talking about some of the impacts of not having enough money, of being low income, of living below the poverty level, health insurance comes to the top. It was named by seven of our focus groups. And what we see is that we have more than 33,000 Johnson County residents who do not have health insurance. And over 5,000 of our kids don't either. And when we look specifically at some of our populations that we know to be at higher risk for adverse health outcomes, we see that our Black, American Indian, Alaska Native, and our Hispanic and Latino residents are at least 3.5 times more likely to be uninsured than our white non-Hispanic residents. And again, we can't do this without talking about Medicaid, as Kansas is one of the 10 states who has not expanded Medicaid, and we keep fighting the good fight, and it looks like we'll be fighting for at least another year. Now this helps. Medicaid helps get people insurance who do not have insurance. It helps get them preventative screenings, helps them be healthier and have the opportunity to lead their healthiest life. Now, when we talk about kids are sort of my space. I have a little one, he's 7. One of the other ways we can look at sort of poverty, low income, people who maybe don't have enough money to afford the sort of basic necessities in life. One of the things we can look at is free and reduced lunch. So 1 in 4 students in Johnson County are approved for free and reduced lunch. Now, I wanted to highlight that approved point because you actually have to apply to get the free and reduced lunch. So 1 in 4 are approved. What that total number is, we're not really sure, right? When we look at our Black and Hispanic Latino students, 3 in 5 of them were approved for free and reduced lunch in the 2022-2023 school year. When we look at our white non-Hispanic students, it was 1 in 6 in 2022. But what I found surprising is that even though our Black and Hispanic students, that rate, the percentage, right, that 3 in 5, that stayed pretty stable. 2018, 2019, 2020, 21, 22, pretty similar across the board. But actually, our white non-Hispanic students have actually had an 18% increase in those who are approved for free and reduced lunch since 2018. The only population actually that had a higher increase in our white non-Hispanic students is our Asian, Native Hawaiian, and Pacific Islander students. They had a much bigger increase. So again, not knowing what that denominator was, like how many kids are actually eligible versus the approved, is this a product of greater financial stress and people are now applying for it? Is it an indicator that financial situations have indeed gotten worse for a great majority of our residents? We're just not really sure, but again, more opportunities for data and looking into it. So in 2022, there was a 10% increase in food prices. So again, this idea of cost, right? Food, everything, it's very expensive. And even though it increased 10% in 22 and 23, and this is an updated data point, prices actually increased almost 6% per the USDA. And for housing, from 2017 to 22, housing costs increased by $300, which was an almost 25% increase. Rents increased by 29%. And when we look at sort of the burden of housing and how much that impacts people and how much money they have, we see that 1 in 4 or 54,000 households in Johnson County were actually paying more than 30% of their income on housing costs. When you look at our renters, 1 in 6 or more than 13,000 are actually paying more than 50% of their income on housing. Now we think about the food prices increasing. We think about these kids, right? Finances continue to be a struggle, and we see the impact of that. Catholic Charities of Northeast Kansas saw a 51% increase in fiscal year 23 over fiscal year 22 in the number of people who utilize their 2 Johnson County food banks. So not only are we seeing the struggle, we're seeing an increase in some of our school numbers. We're seeing a dramatic increase in our food bank usage. People are struggling financially in our community. Now, when we tried to ask this question, right? And so in Johnson County, of our CHA respondents on our survey, 3 in 10 reported they were usually or always stressed out about finances in the last 12 months. When you take a minute and think about in the last 12 months, How often were you stressed about your finances? And when we asked our low income residents, it was 50%. It was 5 out of 10. Now, mental health, this is my one data point, but I'm going to use it. And for what it's worth, this is actually cheaper than my therapist. For your own knowledge, mine's about $145. Mental health care is expensive. That's so necessary. We heard about it, about the students in the previous session. Mental health care, affordable, accessible mental health care is critical. And the reality is that a number of our therapists and mental health professionals don't take insurance for a number of reasons. Some of those being the reimbursement policy, the requirement for a diagnosis in order to receive reimbursement, and sort of the delay time in getting that approval and having to interrupt their care with their patients. This is a struggle for every community. It's not just ours. And we see some of that bear out. In 2023, the Mental Health Center received 2,200 suicide-related calls on their crisis line and on 988. That's up through both of them. This is a 43% increase from 2022. From 2018 to 2022, we think about some of these other outcomes, right? So somebody's stressed, somebody's looking for, they just overwhelmed with life. They can't go see a therapist because they can't afford $130 a session every week if they can find one to get into. Maybe they're having mental health crisis. They're calling our suicide hotline, our center, mental health center. Another way that individuals cope with mental health distress is through substance use. And we see that in 2018 to 2022, the rate of emergency room visits for opioid poisonings nearly doubled. And fentanyl-related drug poisonings have increased more than 5 times. We, in this community, and again, this is not unique to us, we are struggling. There's a lot of members of our community who are struggling for a number of reasons. Finances really seem to be a theme that exists throughout in this community. And I'll be honest, it was the same 5 years ago when we had our last conversation about our community health assessment in 2018 and 2019. So how do we come together to affect change? Get involved. So we already have 2 coalitions, one of which was sort of born out of our last community health improvement plan, and that's the Prevention and Recovery Coalition, which looks at substance use prevention, and it has 5 different work groups. There's a QR code there, you can get involved. If you are passionate about suicide prevention, we have our Suicide Prevention Coalition, which has been around since 2013. But it's a great group of individuals who are committed and passionate about preventing additional losses due to suicide in our community. Staying in the loop. Like, I'm an epidemiologist, I live and breathe data. That's how I go, that's how I roll in my life. But I think that data and stories are how we understand truth and facts. So when this page is updated, so if you do that QR code, you can put in your email and your name, and we'll email you when our community health assessment dashboard is updated, and then share it. Share the things you find surprising or confirming with your friends on social media. Help people understand that their story that they are telling themselves about this community may not be the full story. And engage. Look, we have a lot of powerhouses in this room, a lot of key partners. It's not just us, it's our community members. But we start today. Stick around for the afternoon, engage with our tabletop exercises and discussions, engage with us as we move forward in our community health improvement process planning, and to identify these priorities and where we as a community can come together to make the biggest impact on our community. And I'm gonna make one last plug, even though I know I'm over time. I'm a big fan of connection. I think that a lot of the struggles that we experience here is because, somebody asks you how you're doing and you're just okay, right? I'm okay, I'm good, things are fine. And how many of us move on beyond that conversation? I think we're struggling as a community. Finances are hard. Geopolitical world, wars in other parts of the country, life is hard and stressful. And too often we try and walk through this life on our own. And when somebody asks us how we're doing, we just say okay and move on because we don't want to burden them. But those are more moments for connection with another human. And so when we ask somebody how they're doing and they say, I'm okay, I suggest you pause and ask, how are you really doing? Allow somebody to share with you what's going on in their life, have that common sharing of understanding of life experience and start moving that I to we. So with that, thank you.